Hi, I'm Dr. Kunal.
I am Dr. Karan. Welcome to the Dental Boys YouTube channel.
Yes. So आज हम लोग एक वीडियो जो इंस्टाग्राम पे कुछ टाइम पहले काइंड ऑफ वायरल गया था एंड बहुत सारे लोगों ने इस पे कमेंट्स भी किए थे एंड बेसिकली देयर इज अ डॉक्टर हु इज टॉकिंग अबाउट रूट कैनाल ट्रीटमेंट and how she can reverse it with a very good nuska which she has in her pocket.
Yes.
So let's go and dive into it.
See her video first.
Not exaggerating at all when
So the first thing when anyone says that I'm not exaggerating at all, that means a big exaggeration is going to
Yes.
come right now.
It's coming. It's in the
क्योंकि
coming.
हाँ कोई ऐसे बोलता है ना मैं exaggerate बिल्कुल नहीं कर रहा तो तभी वो सबसे ज़्यादा exaggerate कर रहा होता है. So let's listen to what she has to say.
not exaggerating at all when I say you don't have to get a root canal done. All you need is 1 tablespoon of triphala. You have to add this to 2 glasses of water, boil it and reduce to 1 glass. To this you have to add 1 teaspoon of Himalayan pink salt and mix well. Hold this in your mouth for 5 to 10 minutes and spit it out. Repeat this multiple times throughout the day. In the next couple of days, you will realize that you don't need root canal anymore.
I hope everybody heard what we just now heard. So, doctor here, she's saying that how to avoid getting a root canal done from a doctor. So she's saying that you add what Triphala
Yes.
powder into hot water and reduce it. So let's start from the beginning. Suppose your tooth requires a root canal treatment. So that's how she's going. Your doctor has diagnosed that you need a root canal treatment. So how to avoid getting that root canal done and cure the infection of the tooth after you have been diagnosed for a root canal treatment? So you have to add Triphala to water, hot water. Very important, hot water. I'll come to why. One tablespoon. I'll come to why hot water I'm emphasizing right now later. So hot water, you add Triphala, reduce it, and then drink it like a kada. Yeah, and after that you and Himalayan salt also, and after rinse nicely and do this continuously throughout the day, and after that you will not need a root canal treatment anymore. Okay, so just for the audience to know, why do we actually need a root canal treatment?
रूट कैनाल ट्रीटमेंट वी रिक्वायर बिकॉज बिलो आवर रूट्स बेसिकली दांत के जो रूट्स होते हैं उसके नीचे जो इन्फेक्शन हो जाता है उसके ट्रीटमेंट के लिए हम लोग भी प्रिस्क्राइब रूट कैनाल ट्रीटमेंट.
So Dr. Kunal has gone a little ahead. I'll come a little back. What is the situation in which you are advised a root canal treatment? So the tooth has different layers, out of which when it reaches what is known as the center of the tooth, known as the pulp, and when that pulp gets irritated, irreversibly, that is what is the diagnosis that we give the patient, known as irreversible pulpitis. That it cannot recover now. It has been irritated so much that without treating it, now it cannot go back to its original condition. So there are many types of pulpitis. Out of that, there is something known as a reversible pulpitis, which the irritation has irritated the pulp up to a certain level, which we can clean and stop the sensitivity that the patient is having. So the patient generally in reversible pulpitis is sensitive to cold, short sensitivity to cold and sweet. So in those situations, that is known as a reversible pulpitis, where the decay has reached the pulp, but it has not penetrated so deep that the pulp is not died and not irritated so much that it requires a permanent treatment. In that case, we can reverse the treatment. That is why it is known as reversible pulpitis, where again you have to go to the doctor. He will clean the affected area, put a proper restoration on it like MTA, biodentine, and seal it with a composite restoration, and then send you away. That is the only way reversible pulpitis becomes. Reversible pulpitis is reversed. Now coming to the stage of irreversible pulpitis. In that, what happens is the nerve of the tooth, which is known as the pulp, which has a nerve and blood vessels, is irritated so much that you cannot. It has gone to such a depth that the dead pulp has to be removed and cleansed and filled, and that is what actually a root canal procedure is indicated for. Now, the indication for that is severe sensitivity to cold, which lasts for a long period of time, and severe sensitivity to hot water. So, if you have been diagnosed by the dentist with irreversible pulpitis and advise a root canal treatment, the moment you will put Triphala powder in hot water and you will have that hot water, the first thing you will go is go back to your dentist because that will really initiate such pain that the patient is going to go back to the dentist. So actually, this is reversible Triphala diagnosis, where you put the hot water and you run to the dentist to get the root canal treatment done. So why exactly we are making this video? The point is that many people are spreading nonsense rumors on Instagram to look cool. That you can reverse a root canal treatment, you can reverse tooth caries, you can reverse this, you can reverse that. So we want to put an end to all this nonsense that everybody keeps saying. You cannot reverse tooth decay. You cannot reverse tooth infection. You cannot reverse a tooth which requires root canal treatment, and you cannot reverse a tooth which is indicated for an extraction. Nothing can be reversed. Only it can be treated. It is, that is the baseline. You cannot reverse anything. Number one. Number two, many people say that the tooth is killed by doing a root canal treatment. Now you have a dead organ in your mouth and it is dead, and you can now it is like a vestigial organ, and the body forms infection, tries to remove it. All that is absolute nonsense. When the tooth is affected by decay and it reaches the pulp at such a level which causes irreversible pulpitis, the pulp starts losing its what is known as its vitality. When you say what is the vitality, it is the blood supply and the nerve supply of the tooth structure. Am I right?
Yes.
So your tooth is becoming non-vital in the sense that decay has reached such a level, it is affecting the tooth so much that the body, when it gets infested with bacteria from your oral cavity. So the mouth has a lot of bacteria which are both good and bad. So now since the tooth is decayed, it has opened a portal into the pulp, and all your saliva and all the food you eat and all that bacteria which is formed overnight when you don't brush in the night, all that gets injected into your root canal system, and that causes your pulp to slowly die. So the first stage is irreversible pulpitis, where the doctor advises root canal, where your tooth is losing its vitality or almost become non-vital, and you are having severe pain, especially sensitivity to hot. Then comes the next stage, which is known as pulp necrosis, where your tooth is completely dead. That time you don't feel any pain, but the tooth is completely dead. In that stage, what happens is since your tooth is already dead, it is not receiving any blood supply. The tissue which is inside the tooth, the pulp, the nerve, and the blood vessel, they are already dead and infested with bacteria. So the tooth is already dead. It is cut off from the supply so that the infection doesn't seep into the bone and the other tissues and travel to other parts of the body. So naturally the supply is cut off. Now at that point of time, if you don't get your tooth treated, that is, what does a root canal treatment actually do? All those dead tissues that are within your root canal system are systematically cleansed. That entire system is disinfected, and then we put a filling inside the root canal to seal it, so that any bacteria which is there within the tooth is whatever has not been disinfected, because complete cleaning is always not possible. We as doctors do 50 to 60% of the work, and the rest of the part is taken care by your own immune system. So our treatment protocol is to reduce the amount of noxious bacteria that is there within your tooth, and then the immune system of your body takes over, because the root canal systems are very intricate, they are very small, you cannot clean every nook and corner. So maximum possible disinfection is done, dead tissues are removed. It is filled and sealed both from top and bottom. That is known as an apical, there is a bottom, and a coronal seal. When it's completely sealed in, then our own immune system, macrophage, and all the fighter cells of your own body take over and kill the remaining bacteria within it. And that is how we save your tooth. We do not kill your tooth. Your tooth is already dead or is dying. We are just preserving it within the oral cavity, and we don't want it to convert into a foreign body infested with bacteria. Because if it is not treated, your tooth which is filled with bacteria will start becoming septic. then you have pus coming out, you have big swellings. That swelling can those type of infections can go travel to various spaces are there within your mouth. When they reach those different spaces and the different near the different lymph nodes, you that becomes lethal. If a untreated tooth is left for a long period of time and it gets infected, there is a possibility that because of it being untreated and because of all the bacteria and all the pus that is forming and all the infection which is draining into the various lymph nodes, you can die because it swells up so much that your tongue falls back, and you're not able to breathe anymore because of the swelling. That condition is known as Ludwig's angina. Am I right?
Yes.
So the reason for doing a root canal treatment is not to kill your tooth; it is to save your life. Also to reduce the amount of bacteria in your body, and that is the bad bacteria. Already, the human body is taking care of many infections that we get locally and everything. With that, if you have infected teeth within your mouth, that is additional load on your immune system. So where and all it will focus at one point of time. So to reduce that load on the immune system, a root canal treatment is advised. It is not to kill your tooth or make it a vestigial organ of our body. Many people tell stupid things. I think you should not believe what people are saying, because nobody wants to kill any organ of your body, and the tooth is a complete organ of the body. So we don't, when we love saving teeth. So when going through the comment section of this post that is doctor had put on Instagram, everywhere many dentists disagreed with her and put forth their opinions. There she was continuously telling everybody, look at the description, look at the description. So I went and looked at the description. So I'll put up the description. So I'll read it out. To prevent a simple tooth infection from escalating into a root canal, consider this Ayurvedic remedy. So again, my question is to prevent a simple tooth infection from escalating into a root canal. So when your tooth is infected, you already need a root canal. So how will it escalate more? So I don't understand this by what she mean by simple tooth infection, but I feel that what she was trying to say is that to prevent a simple cavity or decay in your tooth from escalating into a root canal, consider this Ayurvedic remedy. So first of all, you cannot prevent the escalation of a cavity or decay into a root canal with any remedy at home. Neither can you apply fluoride on your teeth and brush it. Neither can you put Trifala on it and seal it. You cannot do anything like that. Decay can only be prevented by going to the dentist and removing that decayed portion of the tooth. Simple.
Yes.
You cannot prevent that decay. You have to remove the decayed portion, and then you have to restore it with the filling if it is in the first stage. Okay, simple, because the enamel which is infected, which has got affected, I will not say infected. Infection happens below in the root, below the roots. It's never on top. When the enamel and the dentine get affected, they are not going to regenerate themselves in any way. Enamel has no blood supply. Anything which has to regenerate, Nico, has a blood supply. It's like a gangrenous part of your. If you get a gangrene in your hand or toe, you cannot do anything about it. You have to just chop that part off so that it doesn't infect the other parts of the body. Simple. So here, luckily, the mechanism is such that you are able to just remove a small portion of the decay in case you come on time, and you are able to restore it without removing the entire tooth or doing an aggressive treatment. That's what I feel. Now she says Trifala has antibacterial properties and pink salt has anti-inflammatory properties. When used together as Kabbalah, pulling in the mouth multiple times, it subsides infection of the tooth. So again, it is impossible for it to subside the infection of the tooth, because even if your tooth is infected, you're diagnosed with a root canal treatment to be done. Your tooth is, suppose it is infected, the doctor has diagnosed an infection. You cannot locally put something in your mouth and treat the infection, because the infectious tissues are within the canals, they are within the periapiral tissues, they are within reaching the bone. That's what you can see on the x-ray as a black hole, because it is starting to eat away the bone. So to do subside that infection, even if you have to control the infection, you have to put systemic antibiotics into your body. You have to take tablets. And if tablets are not helping, you have to go IV also sometimes. So I don't understand that how putting something in your mouth and rinsing with it is going to subside the infection. Neither decay can be subsided. Whatever decay, it cannot be reversed. Like I said, it has to be removed from the body. It has to be chopped off.
Yes.
It has to be removed and filled. Using this every day can also help prevent tooth decay, which can eventually lead to the need for root canal. False. First of all, she's saying is antibacterial, anti-inflammatory. So, how will it prevent decay? What is the mechanism of decay? So your tooth gets decalcified, your tooth is infected, the decalcification occurs over lot of period of time. ऐसा नहीं होता है कि रात को cavity है और सुबह का होल हो गया, ऐसा नहीं होता है. It happens over 6-7 years, 8 years. You only realize that it's paining when you start feeling the sensitivity. By the time it has progressed deep. Nobody comes for regular checkups, doesn't show the doctor regular, very few people do it. उनका जल्दी पकड़ा जाता है and it doesn't go lead to a root canal treatment. So this portion saying that antibacterial, anti-inflammatory, it is absolute joke. The only relief you can get is a very interim relief. Maybe because you put some, it's like applying that clove oil, which पुराने ज़माने में वो लोग करते थे, एक क्लाव रख देते थे. That is known as the principle of irritation. Where अगर आपका एक हाथ पे कट है और आपको बर्न ये हो रहा है, पेन हो रहा है, तो आप दूसरा हाथ पे ना गरम चटका दे दो. तो इतना पेन यहाँ पे चटके की वजह से लगता है कि आप दूसरे जगह का भूल गए कि पेन कहाँ पे. सपोज आपके लेफ्ट हैंड पे अगर एक कट है और आपको बहुत पेन हो रहा है, तो राइट हैंड पे चटका मारो. तो आपका लेफ्ट हैंड का पेन भूल जाओगे ना, क्योंकि यहाँ का पेन ज्यादा है. वैसे ही क्लव ऑयल वैसे काम करता है. इट बर्न्स द टिश्यू सो बैडली दैट यू फॉरगेट दैट द टूथ इज पेनिंग, बिकॉज द बॉडी फॉरगेट्स इट्स treating the other cause of pain. So that is not a treatment or a remedy. This with warm water, hot water and all that is just interim type of relief, which is not possible, because if you have irreversible pulpitis, like I told you, you are going to have pain when you touch hot. Na, पूरा कूदोगे इधर से उधर. You will jump everywhere in the house each time you put Trifala in your mouth with hot water. Absolute joke. You cannot prevent decay, you cannot subside the infection, because systemic होना चाहिए. टैबलेट खाते हो, खून से आके वहाँ पे affected area में एंटीबायोटिक्स पहुँचता है, वो आपके ब्लड सप्लाई से आता है. वो ऐसे मुंह से रख के नहीं होते, कोई नहीं कर सकते. हम भी एंटीबायोटिक ऐसे इंजेक्ट नहीं करते, हम लोग आईवी देते हैं या फिर मुंह से देते हैं, which is the best way of doing it. Then she says, if this is still not helping, you may need to consult a doctor. No, you just consult the doctor and get the treatment done. Don't try all this shit at home. It's not going to work. This is an absolute joke. And then
the problem which I had, कि she did not mention any of this in her video, because when the video was made as like this, कि थोड़ा dramatically वो उस चीज को present कर पाए.
let me not over exaggerate.
And she also said it very confirmly in her video कि हाँ इससे हो जाएगा, ठीक है. And in disclaimer, या क्या बोलते हैं उसको, description में we have to go and read now, and then we have to think like.
पर जो डिस्क्रिप्शन दिया है ना, उसका सिर पैर है. ना जो वीडियो में बोला है उसका कोई सिर पैर है. क्योंकि क्या है ना, they don't have knowledge about dentistry, to be very frank.
Yes.
I don't know what degree she has or whatever it is.
No, she's an Ayurvedic doctor.
Ayurvedic, whatever. Ayurvedic हो, जनरल फिजिशियन हो, MBBS हो, MD कार्डियोलॉजिस्ट हो, न्यूरोलॉजिस्ट हो, पर उनको दांत के बारे में कुछ नहीं पता. They don't know anything. They are not taught about it.
Yes.
They don't know anything. In fact, we learn MBBS subjects for 3 years and then do specialized dentistry in the final year. They don't know anything about dentistry apart from कि कौन सा tooth का नाम क्या है. सच में ये fact है. ये सब किसी को नहीं पता. We'll make another video on how MBBS people misdiagnose dental problems. That's a separate topic altogether. But I'm just telling generally for the public to know that MBBS doctors don't have any knowledge about dental. Nothing. They are not taught only. Then second thing is, I see the comment section, I'll put it up for you. Just a year late, I wish I was aware of this when I got the RCT done. So this is how people are getting misguided. That's why I'm reading it. So many people ask this question saying that, will this help in reducing cavity? Absolutely not. Does Trifala stain teeth? I used it as tooth powder for a month and had, okay, Someone of ours used it as a tooth powder for a month and had his teeth stain which did not reverse. Okay, so this is what happens if you will, uncontrollably use it to try to cure. Your teeth will get stained because we don't know what ingredients are there actually in all these things. So these can act because I somewhere I read it as tannins and quinolones and all that. They stain your teeth. They can abrade your teeth depending on the powder what you're using. You brush with it and manjan bhi karte hain log. I'm pretty sure people will be doing it. So they all get rough, and then you have stains coming out, discoloration of teeth. Then you have to visit the dentist for some other problem because of all this. So coming back to Triphala powder and this kada and that kada and I don't know what kada. What I want to tell is that to the doctors who are saying these things on social media just to, I think, earn some clout and some brownie points and so gain some more followers. I think they want to be influencers. Please do not spread nonsense about my field, our field, because you have no qualification to do so. You are absolutely unqualified to talk about dentistry and how it works, what are the intricacies. We are there to, and I think there are more than required dentists who are there to guide patients for all this. I don't think other field doctors should try to jump into our field, especially with zero knowledge. Absolutely zero. मैं तो माइनस में बोलूँगा, माइनस जीरो नॉलेज, कुछ नहीं पता, बस इंस्टाग्राम पे फॉलोअर बढ़ाने हैं तो आज एक एग्जैजरेशन वाला बोल के वीडियो बना देती हूँ, 4 डेंटिस्ट कमेंट सेक्शन में गाली देंगे, कौन देखने वाला है?
हाँ, the more comments you get basically उससे ज़्यादा
हाँ, तो जितना एंगेजमेंट बढ़ाते हो उतना आपका क्लाउड बढ़ता है, उतने फॉलोअर बढ़ते हैं. उसमें से बहुत सारे अनएजुकेटेड लोग, आजकल तो जियो के वजह से सबके पास इंटरनेट तो है ही, सब लोग के पास इंटरनेट है. सो एवरीबody will see these things, they'll try it, then they will go crying to the dentist and all that stuff will happen. And you will gain followers, you will be you act like some savior कि मैं बचा लूंगी आपके दांत को, पर आप नहीं हो डॉक्टर वो दांत की, आप मत करो ये सब. मैं बोल रहा हूँ कि मत करो. ये आपका फील्ड नहीं है, इसको मत टच करो, छोड़ दो इसको हम पे, हम हैं बैठे हुए इतने सालों से. मैं वही बोल रहा हूँ, मेरे माय फादर हैज वी हैव रूट कैनल्स विद 38 ईयर एंड 40. पेशेंट तो मरा नहीं, रूट कैनल जिंदा है, दांत भी जिंदा है, सब कुछ जिंदा है, कुछ फर्क नहीं पड़ता है. All these Instagram influencers, many people are saying holistic dentistry के नाम पे extract the tooth. Wherever possible, just save your teeth. Do not fall for all these social media things. Consult with whoever your doctor dentist is, and they will give you the proper advice whether to save the tooth, whether to remove the tooth, whether to do root canal, whether to do filling. Don't do self-diagnosis. Don't do Google diagnosis.
Yes, ChatGPT also.
Don't do Instagram. Don't do YouTube diagnosis. Don't listen to other doctors from other fields because they know nothing about the dental field. They have no idea. I'm very openly telling this on a public forum. They have zero idea about it. I am no this thing because I've seen it over the years. That the advices that they give are not in the interest of the patient. So it's a warning that don't, all the doctors or whoever it is, don't give advice about anything other than your field. Like we don't tell you how to control diabetes.
No. With this video, I want to tell कि अगर कोई न्यूरो का problem हो तो you can come to me, and अगर नी में कोई problem हो तो you can also come to me.
हम लोग ऐसा नहीं बोलते ना कि इम्प्लांट भी डालते हैं तो आपका नी रिप्लेसमेंट भी कर ही देंगे, सेम मटेरियल से डालते हैं यार. So we don't do all this, right? We do not give advice about any, even if you come with a flu or a cold, we don't give any medical advice about small things in the though we have studied about it. We do not advise that. Same way, I would advise all the other doctors apart from dentists that don't give advice for dental field to your patients. Refer them to a dentist. See what the dentist says. There are many dentists. Everybody will give a proper opinion. Do not go outside the domain of your. Do not go outside your domain. Don't do it. Okay. So all in all, I would say thank you. And like, share, and subscribe, and apply Triphala on your nose to remove pimples and acne. Bye.